I'm going to focus on healthcare, the state of healthcare in the UK and the government response, because I've got some serious issues. We all know the NHS is in crisis, it's broken, it's failing. Even the supporters admit it to the greatest extent ever seen. And I think most people now recognise that it's not a question of money. The average spent on healthcare is now about the European average. It's all about the management, or should I say, the poor management. Now, I declared before Christmas, that we face a national healthcare emergency, and I put forward an urgent plan for resolving it, where you can attract and retain existing staff and attract staff back into the NHS. How? I had a simple, bold plan that for 3 years, all frontline patient-facing staff in the NHS and in social care would have zero basic rate income tax. And I said how to pay for it. And that, for an average nurse, would involve about a 15% increase in their net take-home pay. It was endorsed by a very well-known Professor Carol Secura, and yet there seems to be a complete lack of urgency from those running the NHS. I mean, look at this headline in yesterday's Sunday Times, from the chief of the NHS, no less. We need to train more doctors. Brilliant. Is that really all Amanda Pritchard could come up with? We know it takes years and years and years. We've been talking about that. But the problem's urgent. It's not in years' time. We've got to deal with it now. A complete lack of urgency. And one of the great issues is that there are blockages all the way through the system. And in my view, that is about logistics. And there's no one better to sort out logistical issues than the logistical specialists from departments within the military, within the armed forces. After all, they sorted out the logistics of the vaccine rollout. They sorted out the logistics of building the Nightingale hospitals. They could be used to sort out the logistics of clearing beds, of creating hotel wards. Because the crisis is now, folks. We've had confirmed the excess deaths numbers for 2022. About 1,000 a week excess deaths. Where's the daily press conference from government ministers, from the chief medical officer? It's unbelievable. It's over 100 extra a day, even when you adjust for population growth. And yet there's almost no discussion about it. And we need to know the cause. It's not good enough for the chief medical officer to say, well, it may be he glibly suggested it might be to do with a lack of statin availability and a lack of antihypertensives during the COVID crisis. A complete lack of urgency, and public confidence is slipping. I think it really is falling away. Now, there are obviously multiple reasons for these excess deaths. And in fairness, it's not just happening in the UK, but it's really, really serious. It's 8 or 9% above the 5-year average, folks. Whether it's ambulance delays arriving at A&E, delays in times being seen at A&E, whether it's bed blocking at the other end. I think the army, logistics, could help sort this out. We know that there's an increase in cardiac issues, in cancer, in lung deaths. There's an issue in people in what I'd call the middle age bracket, the 35 to 60-year-olds. A really alarming concern about the increase in those deaths. In my view, what I'm calling for is there needs to be a proper, rolling, independent analysis of the cause of these deaths, because it might be there could be some quick adjustments, for example, on the logistics, that could help immediately start to save lives. Now, there are some concerns by various people in various quarters that within the excess deaths, there may be side effect issues from the vaccines. Well, surely the best way to assess that and to analyse it is an independent analysis, because that will deal with some of the wild conspiracies out there. I mean, if the government experts, the government departments and regulators, they're completely convinced, and they reiterated to me before this programme, the vaccine's safe and effective, and the vast, vast majority of all the medics, the scientists and the experts in the UK and around the world believe that. Well, in which case, surely the right way to prove that is part of this independent analysis that I'm calling for. Because equally, there is a small but significant number of very well qualified people who have concerns. Now, look, I've had 3 jabs. We all want them to be safe and effective like other medications. But we have to be honest, folks, this is now becoming a news item. In the United States, on Friday, the US's own regulator, the Center for Disease Control and Prevention, what's called the CDC, they released a statement on Friday afternoon saying that they had spotted a safety signal within one of the latest versions of the Pfizer vaccine that may possibly lead to an increase in ischemic strokes above the age of 65. It's something they've not seen in some of the other mRNA vaccines. But equally they said it's a very slight risk. But they raised it immediately when they saw it so that there can be an understanding. We know the governor, the recently re-elected governor of Florida, Ron DeSantis, potentially the Republican nominee for the next president of the United States. He's set up a grand jury in Florida to look at the mRNA vaccines. And he's supported by Florida's own Surgeon General, who tweeted out on Friday his criticism of the CDC, why they made this statement on a Friday afternoon. So, look, whether the UK authorities like it or not, this is a growing, ongoing news item. And I think that the UK is starting to look a little bit defensive on this issue. I mean, where's the discussion about, well, why has Denmark made the decision not to vaccinate the under 50s? I don't know. It may be a good reason. The UK authorities may feel they're wrong. But they should explain this to us. I think they need to be much more transparent. And I did invite the Department of Health on to discuss this, but they declined. Now, the issue here is one of transparency. I had last week an oncologist on who was just using some anecdotes to raise his concern. There are other concerns being raised. The right thing to do is to have an independent analysis of all of this within the broader context of the excess deaths. Instead, what we are seeing from the UK government and the British establishment, I believe, is extraordinary. Instead of being more transparent and proving that they're absolutely right in their views, they're doing the opposite. They're trying to shut down debate and discussion. And anybody that wants to raise it, they're trying to cancel and smear with all sorts of, frankly, unfounded and sometimes horrific allegations, indeed potentially libelous. So you've had one MP this week cancelled, the whip withdrawn from his own party. And then, just I think on Friday, a councillor in the Midlands who said that that MP was right to raise issues, that councillor was also suspended. So do you see what's happening here? Elected representatives are being suspended if they have the courage to raise an issue. So it seems now if you're an elected representative of the Conservative Party, you're not allowed to raise this issue at all. And of course what they're trying to do is to terrify people into silence. Surely that's more of an indication that they're worried about something, rather than they're utterly 110% confident of their position. There's nothing better than the disinfectant of sunlight, of data, and of evidence into the debate, to knock on their head misinformation, misunderstandings, mad conspiracy theories. If you don't do that, if you try and just bury things, then those conspiracy theories will grow and bubble under the surface. So I say again, the right thing to do is actually the opposite. It's to adopt the sort of approach that I think we're beginning to see in the US. If they see an issue, they raise it. They say what they're going to do about it. No one's perfect. This stuff's difficult. But we have to have the courage to look at the emerging data, to look at the unintended consequences. If the government's completely right, if it's utterly confident of its own position, then let's talk about it. Come on these shows, prove the data. There's loads and loads of published studies in the UK and around the world confirming the effectiveness of the vaccine. So prove it, folks. Talk about it. Don't smear, don't label, don't cancel, don't censor. That is my view. Because I'm concerned there is a genuine healthcare emergency across the UK with broader issues, ambulance delays, A&E delays, bed blocking. A friend of mine had an argument with an iron girder on Friday night. You can imagine who lost. Yes, my friend lost. He was in A&E for 24 hours. Unbelievable. Serious damage to his eye. This is not acceptable. This wouldn't be happening in other nations. So in summary, I do think we need a rolling, independent analysis of these broad excess death numbers. What's going on? Are there some quick fixes, some quick wins? Can the army logistics people and others help? We've got to deal with this urgently. We can't wait 5 or 7 years to train a few doctors, Amanda Pritchard. Come on my show, talk about it. It's not good enough. And with that, here endeth my Sunday sermon.